a prior life, I was a hospital administrator, and I've been with York Wallcoverings since that time. The functionality that you need in healthcare is a little bit different. You need serviceability. You know, you're dealing in high traffic areas, so you have a lot of requests per function. It has to be obviously ability to clean and be maintained by housekeeping. It's a 24/7 operation. So there's a lot of function that has to be there, but at the same time you want it to be engaging and welcoming.
There has become less differentiation, I think, between healthcare, assisted living, and hospitality in general in the marketplace. I think a lot of products that have been used typically in healthcare in the past are not always the norm anymore, and I think products that maybe were used more in a hospitality type setting are now being used more in a healthcare setting to establish more of a home feel, aesthetic, not so institutional.
Now all the healthcare facilities are looking at wall covering because it has longevity. It also has therapeutic qualities, you know, for patients' recovery. Because they're in a space, they're in a hotel setting that makes them feel much more comfortable, and therefore mentally they feel better.
A lot of people think that when they're trying to make a decision between paint and wall covering, they think that paint is the cheaper route to go, but that's not necessarily true. Paint may last 2 or 3 years before you have to repaint, and wall covering with its washability, even though it may cost more in the beginning, it will over 7 or 8 years up to 15 years, wall covering will hold its look and be able to be washed to where over time, if you compare it by the time you go through it, wall covering is more economical than paint in the long run.
The overall look of senior living needs to be much more sophisticated, not so much looking like your grandmother's home. One of the other things that I think has taken place in the senior living market is a lot more wood, or even wall coverings that look like wood for cost savings. And then also feature walls. Feature walls not only in the resident room, but also in the public areas, in the senior living facilities.
The sustainable side has been addressed by the Wall Covering Association for many years. We've addressed it in different ANSI situations. We've gone NSF 342, which is our own wall covering sustainability statement. We also have indoor air quality on CalProp 1350, which all of the manufacturers comply to. We also have CalProp 65, which is a chemical awareness proposition in California.
As opposed to paint, wall covering in a healthcare setting is going to achieve a much warmer effect on the wall, a very much more tactile look for anyone who is in that setting. Again, the real goal in healthcare, assisted living, is to make the area look more like a residential feel and have the warmth of a residence. And so therefore a wall covering that has a nice embossed texture to it, or maybe some beautiful prints, some nice metallics, is going to give a much warmer, inviting effect than just a solid painted wall.